Hi, I hope everybody's doing okay. It's so weird seeing myself on camera with no hair. This is the first video I've done since I had it cut last weekend, so yeah, it's definitely taking some getting used to. In my last video, I talked about how I got a diagnosis for lipoedema in the UK. So today I just wanted to go through some of the treatment options available, and also talk about a little bit about the surgical route and why I've chosen to take that route. So after I saw Dr. Gordon at Parkside, she wrote a letter to my GP explaining that I should be wearing made to measure compression. I've talked about this in other videos, but compression is really important as it moves lymph fluid and blood up your legs to your groin so that it can be drained, and that means that the fat cells can't hold on to it. So compression is really important for stopping progression. But also it makes your legs feel lots better. I've found since I've been wearing compression that I don't have the heaviness around my ankles so much anymore. So as I said, Dr. Gordon recommended to my GP that I should have made to measure compression, which is available on the NHS. You can have 2 pairs every 6 months. She referred me to a lymphatic clinic who gave me an appointment 5 months later. And I couldn't wait that long for an appointment. So I actually contacted a manual lymphatic drainage specialist who also was able to measure me for compression, and then she submitted a prescription to my GP who processed it, and then I could collect my compression from the local pharmacy. So if you are struggling to get an appointment on the NHS or the wait times are very long, I would definitely recommend doing that, and I'll pop a link under the video for the lymphatic drainage website in the UK so that you can find a therapist near you. So I've been wearing compression, made to measure compression, since February. I did buy some off the shelf to tide me over from sort of November time, but I can't tell you the difference they've made. It's like a love-hate relationship. You kind of hate wearing them because they're hot and they're difficult to get on, but they make you feel so much better. So I definitely recommend getting those, and as I said, they would stop progression. The other 2 things that Dr. Gordon mentioned, and actually the clinic Lipomedical in Madrid also spoke to me about this, is diet and exercise. So from a diet perspective, generally an anti-inflammatory diet is recommended for managing lipedema, and that means no red meat, low gluten, low sugar, and low dairy. So on a typical day, I will eat something like porridge for breakfast, or I'll have dairy-free yogurt with low sugar granola. And be careful when you're looking at low sugar granolas, because some of them have like 5 grams of sugar per serving, some have 1 gram. So make sure you're checking the labels. But I'll have dairy-free yogurt with granola and fruit. And then for lunch, I'll have something like a grain bowl. So we'll do like lentils or brown rice with fish or chicken and vegetables. And then in the evening, I'll cook something like a Thai curry with coconut milk, and we'll have brown rice with that. And then I always snack on fruit, or I'll have a kind of sweet treat in the evening, just because it keeps me sane. I really love chocolate, and I think cutting it out completely would make me go crazy. So generally day to day I eat really healthily. I do have the odd takeaway. I try and make the right choices where I can. I didn't want my diet to take over my life. I wanted to still be able to live my life, and I'm a real foodie. I love my food, but it is really important that we eat anti-inflammatory foods as much as possible, and avoid the food groups that I mentioned wherever we can. And then exercise. Now, I absolutely love exercise. It's so good for my mental health. It does really keep my head on straight, and since the gym's shut during lockdown, I've really struggled. But for lipedema particularly, swimming is really good, cycling is really good, and yoga is good if you can do yoga comfortably, considering your legs are heavier. Some of the positions in yoga I struggle with, but the main one that's really good for lipedema is walking, and it's free. You just put a pair of trainers on and you can go as far as you like, as far as you can. So I try and do 10,000 steps a day wherever I can. It's not always easy with an office job, but walking is absolutely number one for us ladies with lipedema. And then the other thing that Dr. Gordon mentioned was manual lymphatic drainage, and I have actually been having that fortnightly since February time. There are mixed reviews on lymphatic drainage. I have it because it makes me feel good. I don't think it changes my legs or does anything really to stop progression of my lipedema. Lymphatic drainage is very important for post-op periods, so which I'll talk about in a moment, but it's essentially a very gentle way of pushing the fluid out of your legs towards your groin so that you can drain it away, kind of like your compression will do for you, but obviously it's manual. The main advice both Dr. Gordon and Lipomedical in Madrid gave me about all of these more conservative methods and ways to manage lipedema is that they won't change the shape of my legs, and they only provide short-term relief of symptoms. So if I don't wear my compression for a day or two, my legs will burn. If I eat inflammatory foods, my legs will burn. If I stop exercising, my legs will burn. And the only real way to get long-term relief of the pain and the symptoms that lipedema causes is to have an operation to have the diseased fat removed. So originally I had contacted Lipomedical in Madrid, as I said, for a diagnosis. After I went to Dr. Gordon, she recommended a couple of UK surgeons to me, and I wanted to do the due diligence and make sure that I was choosing the right surgeon. So I contacted 2 different surgeons in the UK. One of them never responded, and the other one wanted £180 just to see me. By that point, I'd paid €50 to see the surgeons in Madrid, and I'd also paid £350 to go to Dr. Gordon. So I wasn't really at that point willing to pay for another consultation. So I joined a group on Facebook called the Global Lipedema Surgery page. And I looked at all of the surgeons' results for my size and stage, and frankly, you couldn't beat Lipomedical. And I later learned that this is because they use a different technique to all the other surgeons. So the surgeons in Germany, the surgeons in the US, and certainly the surgeons in the UK. What became apparent is that it's very important that you use a lipedema specialist if you're having surgery for lipedema, and that normal liposuction, it just wrecks your lymphatic system, and can cause long-term problems. So if you are going to have surgery for lipedema, please make sure you are seeing a lipedema specialist. And the surgeons at Lipomedical in Madrid are absolutely specialist surgeons. They only operate on lipedema patients. They don't do any other type of surgery. So that was very reassuring. Other reasons I have decided to go for Lipomedical, other than the results that I've seen and the fact that they're not comparable, and also the fact that they are more cost effective than going to surgeons in the UK. They use water-assisted liposuction, which is the preferred method of treatment for lipedema. I've heard about surgeons in the UK that use Vaser liposuction, and I've heard lots of horror stories. So it was important to me that I chose a surgeon that didn't use that method. The surgeons at Lipomedical use general anaesthetic. I knew I wanted to be asleep. I didn't want to be awake hearing what was happening. But if you would prefer to have local anaesthetic, there are surgeons that do that. When I had the consultation with them, they acknowledged that the appearance of my legs is as important as relieving the symptoms. So the way they look and the pain that's caused mentally is probably as significant as the physical pain that I feel. And actually, I've only really started feeling the physical pain in the past few years, whereas the appearance of them changed when I was 15, and all through school and university, people made comments about my legs. So for them to acknowledge that how they look is really important, as well as relieving the symptoms. Obviously, relieving the symptoms is number one. Then that I found that really reassuring. Additionally, they had examples of long-term results, so patients who were operated on, say, 8-10 years ago who have not had any regrowth, and that gave me confidence that the pre-op, during-op and post-op care that they provided was absolutely right for lipedema patients and enabled us to get rid of the fat long-term. And then finally, Lipomedical ask for lots of pre-op prep. So I have been to see a vascular specialist to check I've had no veins, and I will talk about pre-op prep in another video because there's lots to it. I've had chest x-rays and blood tests and all sorts, and actually the fact that there was a significant list of pre-op prep to do really reassured me that the surgeon was very thorough. But finally, I think that choosing a surgeon for an operation that's as monumental as this one, and there's a girl called Emma who I speak to regularly on Instagram who has the same surgeon as me the week after me, and she said it was like buying a house. You just get a feeling in your gut when you speak to them. They make you feel like everything is going to be okay. They make you feel as though they really care about you. They care about your results. They care about you being healthy and having a successful operation. And it's so right. It's like you're walking into this and it feels right. So my advice to anybody who is looking for a surgeon for lipedema, visit that global Facebook page because it is helpful for seeing lots of different results from lots of different surgeons. I would take some of the stories and comments with a pinch of salt. At times it can feel quite draining with scrolling through it, and I've learned that the hard way. I would do the due diligence, so check out a few different surgeons so that you can be certain you're making the right decision. For me, after my experience with surgeons in the UK, Lipomedical were a no-brainer. And finally, if you have any questions, my inbox on Instagram is always open, so please just drop me a message and I will do my best to help. Thank you.